How are we gonna avoid having a root canal? Have you ever been told by your dentist that you're gonna need a root canal and you don't have any pain, you don't feel anything in your mouth? How do you know if you really need a root canal? They usually know, but still are afraid. They don't know that in my office they're gonna have a lot of fun, because that's what I try to do to make them fun, because I'm an anxious patient. And what is a root canal? Some of my patients that come referred by my dentist that are amazing, and they said, Dr. Ackerman, what is a root canal? I don't understand what is a root canal. I know they told me, my dentist said that is something about my nerve, but I really don't know. And I'm talking to you because people with money, no money, actors, I treat everybody, has the same questions, okay? We have every single organism the same in our body. So endodontics is the specialty of dentistry. You have to study 2-3 more years where you're gonna save the tooth. This is about saving your tooth. Our specialty, actually, we are so blessed, and that's what I love what I do, because it's the last step before you have an extraction, which means this specialty, really the definition is that we have to prevent having a root canal, and that's what I'm gonna teach you, and we have to save the tooth. And it's about going inside when the tooth is affected. This is the enamel, this is the dentin, and this is the nerve, what the patient call it nerve. And the nerve is a vascular system, and this vascular system has an artery, a vessel, and a nerve. And it has an immense amount of being able to defend itself against all of us, the dentist, and against every single attack that we do as patients when we're clenching, grinding, and eating and biting eyes, chicken bones, whatever we do, this tooth and this vascular system has a lot of defense mechanism to help us survive our denture. So what happens is, if you start having a cavity this way because you didn't go to the dentist, because you didn't floss your teeth, for whatever reason that I'm gonna tell you how to avoid later, so we go inside and we clean it up, we clean the infection, and that is a root canal. The second part that I wanted to tell you is, how do you know you need a root canal? Well, this is how do you know. You're gonna have pain with, I'm gonna put you the side of the model so you can see how bad looks a decay, and that's how it looks in an X-ray, and hopefully I can put an X-ray pretty soon here on the screen. But if you have pain with cold, hot, sweets, when you're chewing, and it's just temporary, let's say you have pain with cold and the pain is gone. You have pain with chewing, the pain is gone. You have pain with everything else and it's gone. But the most important test that we have is the cold test. And the cold test, if you drink anything cold and the pain lasts for more than 6-10 seconds, that is implicating the nerve. That means this nerve is already inflamed and it's telling the brain, listen, something is happening in my tooth and I need to take care of it. At this point, the brain doesn't know which tooth it is. And that's why some patients say, well, it could be the front, the back, and that is called refer pain, which is a topic I will talk to you guys later, where you can have pain from the heart, referring it to the tooth, the muscles are too tight and are referring it to the tooth, and you don't need a root canal, maybe because you don't have decay, you just have that pain, but it's because you're clenching your teeth. You only are gonna need a night guard. But if the pain is constant with cold and you drink cold and the pain lasts and lasts, and the patient said, oh, it's there, and it takes several minutes to disappear, or if you have to take pain medication like ibuprofen, Advil, Tylenol, any strong narcotic to get rid of the pain, that is most likely a root canal. If you feel a bump in your gum, that is a root canal. So your dentist, your endodontist at that point, your dentist sent you, and your endodontist has to find out which one is the tooth if you still are not sure. But even if you're sure this is the tooth, I always retest, because if the patient complains about this tooth, many times the problem is coming from these two. So be careful when you're describing your pain. If you see there's a little question mark if you're gonna need a root canal or not, just wait another week. Unless the pain is constant, non-stop, they have to find out which one is the tooth, because if they open 1 or 2 teeth and they're not the cause of the tooth. There is a patient at UCLA that used to play the violin, and the muscles were stretching so much and they have root canals all over the mouth, and she didn't even need need a root canal. It was just the muscle pain. So your endodontist will do step by step, but the symptoms are this. The cold is intense, chewing is all the time because now you have an infection and you cannot sleep. If you sleep like in this position, the pain is worse. All of that signs that you most likely need a root canal. Don't wait, especially if you're gonna travel, because if you're in the air or you're a scuba diver, the pain is gonna become worse, that you're gonna jump out of the window or the building or the plane where you're gonna be, because there's nothing that's gonna take away your pain until an endodontist can enter and create a hole to release all the gas and all the liquid that is inside the tooth already accumulated because of bacterial infection. So if they give you antibiotic also, it's a good solution because that will help you in case the infection is already formed. But what happens if you don't take care of this? Well, if you don't take care of the infection, it can be so big an abscess that goes to the spaces of the brain that you can end up with a septic shock in the hospital. Many people doesn't know, physicians know, and dentists that we are trained in this, we know what can happen if you get into an infection that is out of control, it has not enough antibiotics, they're not that strong, and you let it go and it goes to any space of your brain. These are very dangerous, and this one in here, also this area, you don't want to get your face like this. There is a video, even I say, try to press, like in the movie Castaway, to see if the pus comes from somewhere, and then you can release, but run to the hospital at that point because you're gonna need IV antibiotics. So avoid the root canal if you see, but you're gonna spend a lot of money because you're gonna need a crown after a root canal. If you have anterior teeth, most likely you don't need a crown after a root canal, you just need a composite. Your dentist is gonna have a clinical judgment to tell you. It's important your dentist give you a lot of time, like I do with my patients, extremely personalized, especially when you get into the office with so much pain. I first of all give a pain medication, and then I take my diagnosis slowly. The endodontist has to give you the time to find what is the tooth. But why do you want to get to this point? Avoid the root canal. Don't have a lot of chewing gum with sugar. Have candies with no sugar if you want, but brush and floss. Floss and brush, I should say, every single time before you go into sleep. Or if you have a candy, you're gonna have to floss and brush. That's the only way that you're gonna avoid it. If you have a dry mouth, ask your dentist what to do. If you are chewing hard things that are affecting your teeth, avoid that and let it rest. The mouth is another part of our whole body. The teeth also, every single teeth is part of our body. It's the same as if you have a finger, except that we have 32 teeth. So you have to think about the teeth in that part and don't abuse your teeth. Floss, brush, and you can avoid most likely a root canal. Go to see your dentist, ask them to check your x-rays very well, and go to an endodontist if you're sent for that. They're gonna have to do a diagnosis always before starting root canal. I hope you understand this. If you have more questions, if you have comments, if you have any single situation you want to ask me, subscribe to our channel, follow us on Instagram, Dr. Fanny Yakaman. Thank you so much. I hope you like it. Bye-bye.